Good afternoon. I'm glad to be here with you today. Thank you for granting me this presentation opportunity. We are Group 12. The theme of our project is to know FLUTD. FLUTD means Feline Lower Urinary Tract Disease. In this project, we'd like to know what is FLUTD and how we can treat FLUTD patients. In addition, we expect to improve our understanding about cats. These are the contents, the background, method, result, and achievement. We studied about FLUTD. To begin with, I will tell why we selected this topic. So far, we learned physiology within the theoretical boundary. Now we try to study clinical disease, especially feline disease. Because the focus of veterinary curriculum is mainly for dogs, we may learn cats roughly. We'd like to study highly occurring disease in real clinical field. So we decided to study urinary tract disease because of the higher rate of cats than dogs. And FLUTD accounts for the highest rate in feline urinary tract disease. Therefore, our topic is FLUTD. We studied FLUTD by clinical cases. The causes of FLUTD are various, so the treatment is different according to the cause. In this time, we will report the medical and behavioral treatment. This is our goal to achieve through this practice. First, we want to apply the knowledge learned in physiology class to clinical disease. Second, we want to know the symptoms and treatment of FLUTD in the case study. In addition, we hope to understand more about cats through this opportunity. We expected to know real clinical disease extending from theoretical knowledge. Further, we could know more about cats and understand them. Cats differ from dogs. Clinical approaches for the cats should be different from dogs because their behavioral or physical characteristics are like those of dogs. FLUTDs are based on lifestyle, so prevention and treatment on the point of behavioral aspect is very important. Cats on the wild state obtain water from their prey, blood, and body fluid. Originally, wild cats' habitats are located on desert, so the cats avoid moisture. Indoor cats need more water because their foods are dry, but the amount of water intakes has not changed. And this could be developed to FLUTD because of excessive urinary concentration. It should be start with general understanding of FLUTD and treatment of the disease. For the accurate and reliable information, we decide to research the papers. These are the references. One is study for the feline ethology, and two are papers for medical and behavioral therapy. Research about general FLUTD study for a week. Next 1 week for the treatment research, and last 1 week is for the preparation of this presentation.
FLUTD describes a collection of conditions that can affect the bladder or urethra of cats. Unfortunately, since the urinary tract can respond to insult in only a limited number of ways, the clinical signs are rarely indicative of a particular disease. We found about the control of clinical signs with behavior therapy through case study of feline idiopathic cystitis. A 5-year-old male nurtured cat presented with frequent dysuria and hematuria for 3 months. Urination was often preceded by pacing and restlessness and was associated with vocalization, suggesting distress either from pain or anxiety. And the owner also observed excessive grooming. The full medical investigation eliminated other causes of FLUTD, leading to the diagnosis of FIC. The cat's behavioral history suggests that stress may be a flare factor, and a number of factors that could be causing the patient's stress were identified. Other household cats that he did not see as part of his social group, cats coming into the garden that he could not chase off, unfamiliar people, and being kept in the same room with the 5 other cats. Behavior therapy program was instituted to remove or reduce the effects of the identified environmental stressors. To reduce the stress caused by the household cats, the patient was given his own area with easy access to all of his resources, like food, water, litter box. Also, visual access to other cats in the garden so that the patient could not become aroused. From this program, the stress factors were able to be controlled, and psychopharmacological therapy was not practiced. The cat was followed up for a period of 15 months, and the treatment result was very successful. There was only one recurrence of clinical signs at 6 months. Further investigation revealed that because of the owner's inattention, the patient accidentally had left with other 5 cats in his own area. This case shows the importance of stress factors that can affect disease.
Physical therapy can divide into acute and chronic. In acute therapy, minimizing stress is the most important. These are often used medications in FLUTD. Azithromycin may help reduce stress. Because of the risk of acute hepatic necrosis, oral diazepam is no longer recommended in cats. Instead, intravenous diazepam or intramuscular midazolam to provide sedation. In chronic therapy, behavior-modifying drugs such as amitriptyline, clomipramine, and buspirone will benefit in cats whose signs are not controlled with environmental enrichment and increased water intake. Be careful. You can decide the effect of drugs after at least 2 or 3 months therapy, even though improvement is shown quickly. The table below shows about the types, functions, side effects, and some of drugs which are often used. First, expand physiology study. We learned deeply the standard physiology course by studying clinical case. Second, FLUTD. We found definition, symptoms, treatment, so on of FLUTD from references, so we can explain about that. Third, understand cat. We found that FLUTD results from environment-related stress arises idiopathrically. In a study of FLUTD case report, feline is a solitary animal that is sensitive to stress. Third, they are influenced by water supply conditions, environment living in a multi-animal household, or around the little tray in the outbreak of FLUTD. So, we found that felines' behavior characteristics different from canines, and specific side effects caused in the feline. And conclude this, our presentation. Thank you for your attention.